Hi, everyone. Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of my live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is your chance to ask me any questions that you have live, so please feel free to put those into the chat. It's also my chance to answer any questions that you might have put over on the channel. Please remember we're on Facebook and Instagram for additional content. And please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator and allows me to be here as a part of this platform. Remember, if you guys have any questions or anything, please feel free to ask them. Please feel free to also give me any suggestions on any videos that you would like to see in the future. I'm going to go ahead and I'm going to get us started with some of the questions that we have had over on the channel. But if you guys have any questions at all, please feel free to go ahead and drop those into the chat. We had some good questions this week that I thought were really good. I'm going to start with one that came in on my STD video, sexually transmitted disease video. And it says, I have PID and I'm pregnant. Will it affect the baby? So PID is pelvic inflammatory disease, and pelvic inflammatory disease often occurs after you have actually gotten a sexually transmitted disease. And so what happens with that is that the sexually transmitted disease causes scar inside the uterus and more commonly inside the fallopian tubes. That scarring can actually lead to infertility. PID can be caused by several different diseases, but is most commonly caused by gonorrhea and chlamydia. So what happens is that it leads to this scarring. So the biggest issue with PID and infertility is the damage it does to the fallopian tubes. Undiagnosed PID or diagnosed PID, pelvic inflammatory disease, is one of the most common causes of ectopic pregnancy. So what happens is you have your ovary, and inside your ovary are all your eggs, and the eggs get released every month when you ovulate, and they come down the fallopian tube into your uterus, right? Now that fallopian tube, it's like a long tube, and it's supposed to be kind of smooth. It's just basically almost like a slide into the uterus. Now, the fertilization of the baby, the fertilization where the sperm meets the egg, happens inside the fallopian tube. But again, that fertilized egg is supposed to continue downward. However, imagine if that tube is not smooth, but instead it's a bumpy, rough surface, the egg can get caught up there and actually implant in the fallopian tube, causing an ectopic pregnancy. And that bumpiness that allows that to happen is the scarring that happens from pelvic inflammatory disease. Pelvic inflammatory disease, it usually doesn't actually affect babies. Even if you had an active infection like active chlamydia or active gonorrhea or something else, we can treat those with antibiotics and get that cured before it would ever affect the baby. If these infections are left untreated, absolutely there could be effects on the baby, but a treated infection should be just fine. Your biggest issue, again, is whether the pregnancy will be able to attach, survive because of all that scarring. So generally speaking, PID is not something we worry about with an active pregnancy. Say hello to my cat, everybody. Biggs has decided to join us tonight. She hasn't joined us in a while. So it's okay for you to potentially have that and have a healthy pregnancy. It just depends on the whole situation. And I think it's really good. A really good transition is that we had a question on the antibiotics video, because again, a lot of the diseases that cause PID, pelvic inflammatory disease, are sexually transmitted diseases caused by bacteria that can be treated with an antibiotic. So on my antibiotics video, it said I'm 9 weeks pregnant and my doctor prescribed metronidazole gel to treat BV. I'm supposed to take this for 5 days. Is this safe? So the short answer is yes, metronidazole is safe for pregnancy. A lot of people get a lot of really bad information about metronidazole, and I'm not really sure why, because Metronidazole is very commonly used during pregnancy. I think that the information that's out there about metronidazole is longer term use at different doses for different diseases. Now, one of the things you guys need to know about antibiotics, it's very common that people are prescribed antibiotics and they don't take them as prescribed. This happens for both pregnant and non-pregnant people. Pregnant people, you are immunocompromised. This is a big thing that people need to understand. Your immune system is not working well, which is why women are always getting sick during pregnancy. So when that happens, if you get a bacterial infection and you've been prescribed an antibiotic, you need to take it all. You need to take it to its completion, because otherwise you can develop an antibacterial resistant disease. And those are far harder to treat. Most of the time, when you talk to somebody who's pregnant and they say they're hesitant to take a medication, they're worried about safety. But what I try to stress to people is, if you've decided to take the medication, it's more unsafe to stop it early than to take it. Because if the bacteria that they're trying to fight ends up being like resistant and we have to give you stronger and stronger medications, some of those medications aren't safe for the baby. Metronidazole is a great medication. It is used to treat bacterial vaginosis. Bacterial vaginosis is one of the common STDs that we have out there. Bacterial vaginosis actually, along with all the other STDs, can be linked to stillbirth, miscarriage, preterm birth, and other things, which is why it's so essential for them to get treated. Now, the one thing I do want to talk about with bacterial vaginosis, since we're kind of there, is that bacterial vaginosis, we put it into the sexually transmitted disease category, but it works a little bit differently than the other sexually transmitted diseases. So this is basically a change in the microbiome. That's the normal bacteria and stuff that lives in your vagina. It gets off usually because of sperm. So sperm has a different acid base makeup than your vagina. And if your partner is ejaculating and there's sperm going into the vagina and it changes that balance, that can actually create an environment where this other bacteria that causes BV can grow. And that's why you get BV. We call it sexually transmitted, but it's not like what you traditionally think about. It's an overgrowth of bacteria that normally exists in the vagina. So that's one thing I want to tell you. But it is still ultimately important that you guys are taking the medications as prescribed. For those of you who are joining me, welcome, welcome. Please feel free to put your questions into the chat. I'm going to go ahead and I'm going to answer the next question that I have. I had a question on baby aspirin, and it said, how many weeks can you use aspirin during pregnancy? So for starters, everyone, let's just make sure we're clear about a couple of things. Aspirin is not recommended during pregnancy in general. So you should not be using aspirin just to use aspirin. Don't use aspirin if you read something on the internet that said use it. You should never do that. Aspirin is a blood thinner, and it has some effects on the blood flow to the placenta. And if you don't need aspirin, you shouldn't be taking it, and it can actually lead to some harm. Now, there are women who absolutely have to take it. The studies show that it is way healthier for them and way healthier for their pregnancies. And these are usually people who are at high risk for preeclampsia. And we have a video on preeclampsia. You can check that out. But when you're at high risk, we start that usually around 3 months. That baby aspirin is there to help with blood flow, to reduce your risk of clots, all sorts of other stuff. But it's a blood thinner. So you have to look out for signs that you're bleeding too much, like excess bruising, nosebleeds, bleeding gums, black poop, black stools. That's a sign that you could be bleeding. Now, in pregnancy, you are normally hypercoagulable. What that means is your blood clots easier. And that makes sense, because when you're going to give birth, right, you're going to bleed. Everybody bleeds when they give birth. That's normal. So your body understands this and wants to prevent you from bleeding too much, otherwise known as a hemorrhage. So what'll happen is the body already has you in this state where you're at a higher risk for blood clots. okay? Hypercoagulable. So what happens with the preeclampsia and stuff is that's not very good for you. So we want to thin out the blood a little bit because it helps with your blood pressure. And that's where we do a baby aspirin for preeclampsia. Now, if you are taking this, as I just told you guys, remember, you are thinning out your blood when you take baby aspirin, and you are going to bleed during your delivery. So usually we stop baby aspirin around 36 weeks gestation, because by 36 weeks of gestation, you're going to be having your baby sooner than later. If you're at high risk for preeclampsia, and that's why you were put on the baby aspirin, it's very likely you're going to be delivering between 37 and 38 weeks. So it's one of those things that we want to get that out of your system so your body has a chance to be ready, that when you deliver, you're not going to be at risk for bleeding out because you were on a blood thinner. So that's kind of where we're at with that. So it's usually up to 36 weeks. Those were all really quick questions, guys. I have 2 more. So if any of you guys have any questions, please feel free to put them in. Okay. So this is a great question that came in on my drying up milk video. So it said, my OB gave me terrible directions on how to stop milk production. Their advice was you just stop. And if you get mastitis again, you get it again. I'm about to be 6 months postpartum, and I've ended up in the ER with mastitis 5 times now. I followed what the OB-GYN said and just stopped. However, I also followed advice from the last ER nurse to help me. I slept on top of a heating pad, but I woke up with my left breast rock hard with many clogged ducts, and that you can see physically from the outside. The right breast wasn't as bad, but still had several clogged ducts. I got scared of getting mastitis again, so I quickly pumped after 10 hours and continued pumping throughout the day every 6 to 7 hours. I still have a lot of clogged ducts and it's starting to hurt again. I'm very afraid of getting mastitis again. How would you recommend I personally go about stopping my milk production without getting an infection again? It seems like I'm very prone to it. So this was in a really very well thought out question. I was so glad that this viewer took the time to write it out. And it's very unfortunate that this experience happened. So breast milk production is about supply and demand. The more you demand, the more the breast thinks it needs to supply. So when it's time for you to stop making milk, you have to reduce demand slowly. You can't go from all to nothing because the breast doesn't realize that it's stopping like that. And that's where you get the clogged ducts. Depending on what kind of producer you are, you can be more prone. Now, there are several things that work to get milk production down fast. The starting point is this person was given extremely poor advice with the heating pad. So I want you guys to hear that. Heat is not good when you are trying to dry out milk. In fact, it does the opposite. So anything in your body, your entire body works on a whole bunch of different chemicals, nutrients, and oxygen and all that good stuff, right? And that is all transported through blood. So your breasts are very vascular. That means there's a lot of blood flow here. And that's how we're able to make milk, because the blood is coming in to help those milk ducts fill with milk. And we need to get nutrients there and all that other stuff. So when you have increased blood flow, you're going to make more milk. So when we're trying to dry up milk, we want cold here. So for starters, you would never use a warm heating pad. That is an absolute no. Now, the next thing is when you're going to take a shower and you want to sometimes it's nice to just sit in the shower and have that warm water on you. But when you're trying to dry up milk, that warm water needs to stay on your back. No warm water on the breast. Yes, you're going to wash your breast really quick. If you need to wash your face, you wash it really quick, but you don't want a lot of warm water here because that will stimulate blood flow. The only time we use heat, we would use moist heat, so like a warm washcloth, is if we were actively working to try to get a clogged duct out. So sometimes when you're trying to pump and work through clogged ducts, you'll put the breast pump on and you'll put that warm heat and massage, and that will help to loosen up that little bit of milk. But after that, you don't want any more heat. So we're working on cold. So we want cold packs. You can ice the breast 3 to 4 times per day for about 10 minutes each time, maybe 15. You want to make sure there's cloth on top because you can actually burn your skin from cold, guys. A lot of people don't realize that. So you have to be careful. So you're going to use cold. Now, the second thing is we like to use cabbage leaves. So cabbage has a chemical in it that when it's applied to the breast, it helps to dry out milk. It's been used for hundreds of years. There is a product over the counter called Cabo Cream. And I'm not actually a big fan. I'm not against it, but the thing is that it's taking the chemical from this plant, and it's putting it into the cream and adding a whole bunch of other stuff. And it is effective. A lot of people have a really good success. But I like the cabbage leaves as well because the cabbage leaves, what they do is you can wash them, stick them in the freezer or the fridge, get them nice and cold and put them on. And now not only are you getting the chemical, but you're also getting the cold. Okay. And that cold is a big thing. So I always try to encourage people. One great example for maybe using Cabo Cream to your advantage would be to say use that at night when you're going to be asleep, hopefully all night, or maybe while you're at work, and then use the cabbage leaves the rest of the time. So we have that. We want cold, okay? Now, the next thing is using stuff that dries us out to our advantage. All those allergy medications. Believe it or not, there are studies that have shown that the allergy eye drops like Visine allergy can dry up your milk supply. Anything that's been to dry you out can help to do that. So Benadryl, Zyrtec, Claritin, these are all things that potentially could help to dry up the milk. So those are something else that you can use. The biggest thing is, like, for example, Sudafed. Sudafed can help, but you want to make sure if you are going to try Sudafed, you need to make sure your doctor's on board because Sudafed can cause higher blood pressure and higher heart rate. So you don't want to use it unless you know it's safe for you. Another thing that people don't realize is peppermint. Peppermint is amazing at drying up your milk. You can drink peppermint tea. You can use peppermint deodorant. So these are things that can also help. Now, as far as the supply and demand, going back there, so if you've been pumping 10 times a day for 10 minutes each time, you can't just stop cold turkey. It's not going to happen. So one of the things you want to do is you want to try to start to reduce the amount of time that you're pumping and stretch it out. So if you were pumping every 2 hours, you start by doing, let's say every 2 hours for 10 minutes. You start by going every 2.5 hours for 10 minutes. Just doing that one little switch, you're probably going to cut out one whole pumping. Then you stretch it to 2 hours and 45 minutes. Then you take it to 3 hours and you drop it to 9 minutes per pump and you go slowly. It depends on how your body reacts, and it depends on, how much of a risk you are for mastitis or plug ducts. But should you be able to do that, that's what you want to do, is stretch it out like that. For anybody who does get a lot of plug ducts, lecithin is an over-the-counter supplement that you can use that helps to thin the milk and prevent clogged ducts and stuff like that, which can help as you're trying to dry up the milk supply. Now, there is one thing that some people get prescribed that I'm very against. And somebody who's had a lot of mastitis and plug ducts is honestly at a higher risk of getting prescribed this medication. The medication is called bromocriptine, or it's also called, I just lost the name. It just went completely out of my brain. So hold on a second, and I'm going to tell you what it is. Oh my gosh. I have completely forgotten, guys. That's what happens. Cabergoline. There we go. I knew I'd remember. Okay, so cabergoline is the other name for the medication that can help to dry up your milk supply. And this medication works well. Here's the reason why I don't like it. This medication, one of the things it does is it boosts dopamine. So when it boosts dopamine, it makes you feel good, which is awesome. So women are starting to get relief because they have their milk drying out, which is what they were looking for. And then they also get this boost, which makes them feel like Amazing, right? Okay, great. But you can only take this for a short period of time. It's usually about 7 to 10 days, and then they stop it. And when they stop it, you go from this high level of dopamine to crash. And that crash can put you at high risk for postpartum depression. And so this is why I'm very, very against cabergoline. I have seen so many different OB-GYNs and midwives prescribe this medication. I'm not sure why, because they don't seem to understand the effects it can have on mood. It is very effective for the milk part. So I understand like they're trying to help, but I would really encourage you not to be using this, especially if you're at high risk for depression, because it's putting you at even higher risk. So I hope that helped out that viewer who was looking for some stuff. Definitely check out, I have at least 2 videos on drying up milk. I have the standard video, and then I have one, I think, on herbs. And it's very important, but the system for pumping is one of the most important things. Hi, Jessica. I'm currently pregnant with twins. My first set of twins. I just found out that I have spina bifida and cystic fibrosis, and I didn't know if these were common. I'm going to ask, do you mean that you're a carrier for the spina bifida or the cystic fibrosis? Because that is important. Are you saying the twins have it? Neither one of those are very common. Cystic fibrosis is a genetic condition that affects mucus production in the body, and it most commonly ends up affecting the lungs because the lungs are constantly kind of filling up with mucus, so it makes it hard for you to breathe. And a lot of people with cystic fibrosis have trouble growing, and they live shorter lives. So that is one of the things with that. I actually had a friend growing up who had cystic fibrosis, and it's one of those things. Now, spina bifida is usually caused by low folic acid intake. So this is why folic acid is one of the vitamins that we really stress that people take. And that's because if you don't get enough of it, it can cause spina bifida, which is a spinal cord abnormality. Spina bifida is more common than cystic fibrosis. Cystic fibrosis is genetic. Spina bifida is more common because some people are folic acid deficient, and some people have MTHFR genetic mutation that causes them to have not be able to process folic acid. Okay, Jess. So they did blood work. I'm thinking that they're saying the twins have that. If they're saying that you have it, you would be a carrier for cystic fibrosis. You would have been diagnosed with cystic fibrosis a long time ago. If it's the twins, then they're probably saying that the twins are carrying that. What they're ultimately going to do, if this is your first set of blood work, and if you're early on in the pregnancy, they are probably going to send you to a maternal fetal medicine specialist, which is the high risk pregnancy doctor. And then they're going to offer you some further genetic testing. Most likely, they're going to offer you an amniocentesis. Amniocentesis, for doesn't know, is where they're going to basically stick a needle through the belly into amniotic sacs to gather amniotic fluid and to test it further for genetic abnormalities. It's more accurate in many ways than it is to do the blood work. The blood work's pretty good. Now, the thing with the amniocentesis is it comes with some risks, and for just depending on whether you have 2 different amniotic sacs, if the babies are in separate sacs or if they're in the same one, it could be even more risk. The biggest risk is that there could be miscarriage. When they pierce the amniotic sac, it's possible that that would cause the amniotic sac to burst, or also known as your water breaks, okay? When your water breaks this early on, it leads to miscarriage. And that's why they are always talking about risk versus benefit of some of these procedures. But what they should be doing now, Jess, is they should be sending you to the maternal fetal medicine specialist who can do more specialized ultrasounds and more specialized tests. So then, Jess, one of the things with you is that because there are the two separate amniotic sacs, you would actually, if you decided to get an amniocentesis, you'd actually have to do it twice. And this is why, if they haven't, you need to have them send you ASAP to do this testing. Hopefully you're in an area that has a good maternal fetal medicine specialist, because what happens, guys, is that when you're pregnant with twins, if one twin is like, if you have a miscarriage with one twin, you miscarry with both twins. And so it has to be very delicate how we handle testing and stuff, because of the two different twins, two different babies that we're dealing with. And with separate sacs, it sounds like these are not genetically identical twins. Genetically identical twins, where the egg actually splits into two babies, right? Those twins usually have the same stuff going on. So if there's a genetic inherited disease, both are going to have that. If you have two separate sacs, one might have something and one might not. So that's that. I hope I answered that well. Feel free to put in anything else that you might have there. I'm going to go to the last little thing that I had from the channel. And I'll keep taking a look. And anybody who else has any questions, please let me know, because this is my last thing from the channel that came in this week. This was a comment that came on, but it was very well put, and I thought it was great because this is one of my passion areas. So it says, I started taking a low dose of Zoloft during my second trimester. My doctor stated at the time that it was safe and that there were bigger risks in not treating my anxiety and depression. I continued to push through and did all the healthy things like exercise, eating well, and taking vitamins. My daughter is now 6 years old and is happy and healthy. She's not perfect. No child is. And we've had some developmental delays, but none of it has to do with taking antidepressants. Everything has risks: food, medications, environmental factors, etc. Mom guilt is real. The shame is real. I wish there had been more videos, support, and help when I was pregnant. Don't suffer in silence. Seek help and do what's best for you. How can you take care of your baby if you're not taking care of yourself first? I loved this comment. I loved it. I was like, oh, I have to read this so that hopefully anybody who hears this is going to read it or is going to hear it and will share it. I started in maternity. I started in a mother-baby unit. I'm a lactation consultant. I did labor and delivery. I worked in the neonatal intensive care unit. I worked in an antepartum unit, which is high-risk pregnancies, like women with complications and different things. And throughout my career, I never imagined I would go into psychiatry, which is what I do now. And I went into psychiatry as I started to see over and over and over again families being told that medication was not safe. Women are told over and over and over again that they cannot treat their psychiatric illness because it is unsafe for the baby, which is completely false. I have also seen the ramifications of men who suffer silently with postpartum depression because nobody recognizes how difficult it is for a dad to become a dad. Mom is the star of the show. And honestly, guys, moms are very important, and mom is absolutely 95% of the focus, but dads need to be up there too. We need to figure out how to navigate that. And so that's why I went into psychiatry. And it's because of stuff like this. I think it is very, very important for us to take a holistic approach, but the data is there. Untreated anxiety and depression puts you at higher risk for miscarriage than all these medications that we're providing people. And now more and more data is coming out that stuff that we used to think was not safe is probably actually just fine. The placenta does a really good job of filtering out a lot of stuff. It doesn't filter out everything, but it definitely stops a lot of stuff from crossing over. Now, here's the other thing that gets me very frustrated. We'll see people over and over and over again refuse medications like Zoloft or Prozac or something that we know can be used, right? They're so worried. They'll refuse antibiotics. That's another thing. People won't take antibiotics for urinary tract infections and different things. And then what do I see at the same time? I see people loading themselves up with supplements. And it's crazy to me because this idea that these supplements are so much safer is just, it's not factually based. So before anybody goes, oh my God, she must only love pharmaceuticals, I have a certification in alternative medicine and culinary medicine for mood. I have patients who only take vitamins. Now, these are not pregnant patients. These are other patients. I have patients taking stuff like glutathione and N-acetylcysteine and ashwagandha and 5-HTP, and I can go on and on and on and on. I am the biggest proponent of supplements, and I wish there was more regulation on them, but there is not. Okay? So there is a whole bunch of things in our factories that are not safe for pregnant people. So an example could be lead. An example could be, oh my gosh, I just forgot it. Talc, the stuff that makes like talcum powder. Example could be black cohosh. That's a herb that's been known to be linked to miscarriage, right? So these are just like 3 examples, right? Now, let's say you're a factory that makes a supplement, because people use black cohosh. It's especially used, it helps a little bit with like regulation of hormones. It is often used for women who are like going through menopause, right? So let's say you've decided you're going to use black cohosh in your factory, okay? You've decided you're going to make this supplement. So you make your supplement and it goes down this belt. Well, what happens in a lot of these factories is that when they're done with their one production, they like shut down, switch over, clean, and go to their next product line. And that happens with food too. I don't know if you guys have ever noticed you've picked up something that clearly does not have peanuts in it. Like there's no peanuts ever, but you'll look at the back of the box and it'll say may contain peanuts. That's because in that factory floor, they manufacture something with peanuts. They stop, they clean it out, and then they go to the next one, but there could be peanut residue, right? So when you're talking about these supplements, the same thing happens. But these factories, unlike food, are not monitored. Nobody is looking to see what's being produced before, what's being produced after. Nobody from the FDA pulls these supplements off and opens them up and checks them for effectiveness. Anytime you guys see supplements that are actually being taken off the market, like pulled off the market, that's because unfortunately, basically enough people got sick or are seriously injured or died, and it was enough for it to be noticed by the FDA for them to pull it off. Otherwise, they're not inspecting any of this. They're not testing purity of ingredients, etc. So you can't take the chance when you're pregnant to take supplements that are too far out the realm of normal, okay? So prenatal vitamins are not regulated either, but you have to take prenatal vitamins. You have to. So there are supplements that you kind of decide you're going to take because they're normal enough that they should be safe. And I'm going to tell you, the cheaper the vitamin, the better the quality. And a lot of people don't realize that. So one of the highest quality vitamins out there is Nature's Made. It's got a yellow label, and Nature's Made is everywhere. So how do we know it's a high quality vitamin? Because it's everywhere. If it was killing people, we would know it. If it was ineffective, we would know it. But instead, it's all over the place and people use it and it works well. And so we know it's a good quality vitamin. If you buy some fancy bougie supplement that like 2 people in the world are using, you don't actually know if it's effective or not because there's only like 2 other people using it. So believe it or not, cheaper vitamins are oftentimes better quality. But once you get past a certain number of supplements, there's a lot of other things out there that I don't recommend for my patients. I don't recommend N-acetylcysteine or glutathione or ashwagandha or anything like that when they're pregnant or breastfeeding because we just don't know enough about them yet. And so that's why I think it's really, really important that when you're doing something like trying to treat anxiety or depression, We have data on pharmaceuticals that are monitored. Okay, so Zoloft is not perfect, not claiming it to be, but it's being produced by manufacturers where the FDA comes in and looks at their regulations, their manufacturing practices. They test the ingredients that they're using to make that. The entire system is being monitored. And then we have actual studies that were paid to study, to like make sure a product was safe and that it worked. And here's what we need to look for. And that's why when you're pregnant, unfortunately, a lot of the pharmaceuticals are the better option. Hey, Jess, the supplements you mentioned, they can help with mood but not for pregnant people. Which supplements? So like, okay, N-acetylcysteine and glutathione are two of my favorite supplements. N-acetylcysteine and glutathione are used to detoxify more than anything. They actually can be used for mold exposure, and they can be used to kind of cleanse the cells. Glutathione actually helps at like the cellular level with like the energy cycle of your cells. These two supplements are by far two of my most favorite supplements of all time. N-acetylcysteine is actually used at prescription strength in really high doses in the hospital to reverse, if I remember correctly, to reverse Tylenol poisoning. So if somebody gets Tylenol poisoning, they actually will give them N-acetylcysteine. So these two are detoxifiers, and we have so much going on in our bodies nowadays that if we do have a lot of toxic overload, that can absolutely contribute to mood issues. So those are two supplements that I use. I have an actively schizophrenic patient who is no longer, who's basically in remission, which means no more voices, no more anything. And that was using no pharmaceuticals, no antipsychotics, none of that. That is only using the supplements N-acetylcysteine and glutathione. So that tells you how strongly I believe in supplements and how effective they can be. However, you can't use those for pregnancy, in my opinion. What?
Restate that.
You can't use that in pregnancy, in my opinion.
Which one?
N-acetylcysteine and glutathione. Sorry. So that's one of the things that I would tell you. Now, I'm trying to think of what else I mentioned. 5-HTP with B6 is another one I mentioned. That one is a really good one for sleep and for anxiety. 5-HTP is a serotonin precursor. So it's like the building block for serotonin. 5-HTP is not well studied. So no, you shouldn't use it, in my opinion, with pregnancy or breastfeeding because we don't have a lot of data. Vitamin B6 is safe for use during pregnancy. It's often used in combination with Unisom to help with nausea. Unisom and vitamin B6 together can help with nausea. But vitamin B6 on its own can help with anxiety and sleep. So I hope that helps. So I was really glad that this person sent in this kind of statement about mental health and the use of medications because it's so key. And again, if you are uncomfortable with medications, please don't just start using supplements because you think that they're the best thing ever. I very regularly get a lot of people taking a lot of different supplements that actually interact with each other, can affect their hormones badly. And in an example, guys, ashwagandha is like the latest thing. Ashwagandha affects your testosterone level. So I find it to be really great for guys and really terrible for women. So just so you all know, that's one thing. So don't just look and say, oh, well, TikTok told me that it was good for anxiety, so that must be it. It's not the case. And I actually don't have a lot of people who successfully use ashwagandha for anxiety. What was I going to say? The number one evidence-based treatment for anxiety or depression during pregnancy or postpartum is therapy. So if you are uncomfortable taking medications, please seek out a talk therapist. Talk therapy can be absolutely life-changing and life-saving when you're struggling with some of these issues, because your therapist is there to help support you, to help reframe negative thought processes, to give you skill sets, to help you manage your mood. So please, anybody who has any questions, please feel free to put them into the chat because I am out of questions on my side. We will be here next week, again at 9 p.m. Eastern Standard Time to answer your questions live. Please make sure you're liking and subscribing to the channel. Please follow us on Facebook and Instagram for additional content. We do have a video of ours coming back out tomorrow. It's been revamped and updated. So please check that out. Please share the channel with friends and family. YouTube really wants to see content creators growing. That's a big thing for them. So please like and subscribe to the channel because that really helps me out as a content creator. I really appreciate all of you guys' support. I appreciate you guys being here. I love getting a chance to answer your questions live. With that, I'm going to say goodnight to you guys a little early today. I really appreciate all of your support. Thank you so much for being here. I'm Dr. Samantha, the maternity mentor. Bye for now.